Hi, my name is Amy Robinson. I am with Enlightened Healthy Living, and I am a wellness advocate for doTERRA essential oils.
I'm Dr. Carlos Santo, naturopathic physician and founder of Wellness One Nation.
So today we are going to be talking about thyroid health.
A very important topic, Amy. I'm glad we're doing this. The thyroid is the most underlooked source of many acute and chronic health problems in the clinical setting today. Do you realize the thyroid, when functioning properly, is responsible for the metabolism, our emotional health, the health of our skin, our hair?
Oh, wow.
Yeah. It's the major energy generator of the body. So if we're cold sensitive, again, we can look to the thyroid as a potential source of that problem. Unfortunately, most doctors are not trained to look at the thyroid, or they just typically overlook it and really only look at it from a problem perspective. In other words, is the thyroid itself, which is right here in the throat, by the way, is it swollen? Is there potential growth on the thyroid, known as a goiter, which we don't really see anymore now that we started to put iodine in our salt, right? Mm-hmm. Iodized salt.
Yeah.
But unfortunately, like in so many clinics and across the medical establishment, if something is staring us in the face, but not frankly right there that we can actually identify in a blood test, we tend to overlook it. But there are many, and the thyroid is the number one, in my opinion, example of this, subclinical manifestations of ill health. And it's really unfortunate because we can correct this by paying attention to the patient rather than just looking at their blood work. You know what I mean?
Interesting. Yeah.
So we want to empower people to look at, in the case of the thyroid, what they can do, first off, to see if they actually have a problem. So a self-assessment. Are you struggling with weight? Again, are you trying to lose weight and it's not working anymore? Maybe you still eat well, you're still exercising the same way, but since you turned this age, you can no longer maintain a healthy weight. Could be your thyroid. As a woman, are you experiencing thinning hair or hair loss? That is the number one place to look first, your thyroid. Do you have excessively dry skin, no matter what cosmetics you're using to moisten your skin? Are you having excessively dry skin, particularly on the palms? Another source of contribution would be the thyroid. We look at that, So how does someone know if it's their thyroid? A very simple way to do it is take your temperature. When you're first waking up in the morning, we call that the basal metabolic temperature, okay, your BMR, BMT. And we want to catch that temperature when our body's at its coldest. And we want to see that the temperature is running a minimum of 97.5. And typically, in a clinical setting, most doctors are going to say, well, the lower the temperature, the better. But in the naturopathic medical world, we see low body temperature as a negative sign, a sign that something is wrong. And it's most often to do with the thyroid. Sometimes it's also the adrenals, another topic.
Yeah.
But right now, if the thyroid is not functioning properly, we're going to see a consistently low body temperature below 97.5 when we first wake up in the morning. Now, for a woman who still has a cycle, it's important that she gets random readings in the morning through different parts of her cycle, because the temperature is going to change accordingly, okay. But it should never, at any part of the cycle, ever get below 97.5. Okay?
So if you're someone that's just cold all the time, you know how you know people that are just always cold, is that an indication of low body temperature, or is that just because you're cold?
Well, your engine is running low.
Okay.
So we want to, again, look at the thyroid. Secondarily, we'll look at the adrenal glands. And again, the approaches here are very easy once we identify the problem. Now, can a blood test identify the problem? Well, yes. Before the problem is, after the problem is really too late, we're going to see it on a blood test. But if we pay attention to the clinical signs, Amy, then we actually can get this corrected long before it manifests on a blood test. What we like to say in our profession is, if you see it on a blood test, it's been there for many years in many cases.
Wow. Okay.
So don't wait for it to show up on a blood test. Find out what you can do now to address the signs and symptoms of a potential problem.
Okay.
We're fortunate when it comes to the thyroid because it's something that stares us right in the face. We can't feel things like high cholesterol, high blood pressure, which is why we do need to get checked out and make sure we're okay. But with the thyroid, we have lots of signs and symptoms that we can pay attention to.
Well, it sounds like it's a very, very important thing for us to be checking ourselves on. It's probably not the number one thing that you would go to. You know, we always try to find solutions in other ways. So I think this has brought a lot of light to, you know, the overall thyroid.
I hope so. And let me just say one thing. When it comes to treating the thyroid, we do have a number of approaches that do work. Okay, so first off, if the numbers are coming back on the blood work and we're fairly happy with what we're seeing, then we might not necessarily go the pharmaceutical route first. We might be able to go the herbal route or the mineral route. Now, one thing we can do is iodine therapy, and iodine is available in over-the-counter in supplemental form, and it works quite well in the proper dose, but you need to be supervised medically to have this done. There are a number of herbs and perhaps essential oils that we can do that can address, and maybe we can discuss that in just a moment.
Yeah.
And then the nice thing is, the very oldest thyroid medication on the market is one that's rarely used anymore in medical circles. And it's called Thyroid or Armour Thyroid. These are both USP glandular thyroid medications that are available only by prescription because of they do contain thyroxine, which is the monitor substance, okay? Excuse me. So we do have these natural thyroid medications available. Most people who are being treated for thyroid disorder are being given Synthroid, which is synthetic thyroxine. And for many people it does help, but there are many, many others who Synthroid does not help because you're only giving one small portion of the thyroid molecule, whereas Thyroid or Armour Thyroid contain the full thyroid complex, T4 as well as T3, along with other trace minerals, which help with the assimilation. And again, healthy liver function is going to be crucial to getting that downstream effect at the cellular level. In other words, the thyroid makes thyroxine, but it must convert to T3 by means of a healthy liver. And if that's not happening, Synthroid will just correct the pituitary gland, but it's not going to correct what's going on at the cellular level. So again, we like to properly assess, number one. Number two, give the appropriate medication for that particular case.
Wow.
So what do you think, Amy? Anything we can do?
Sounds like an easy fix. Yeah, there's a lot we can do on the essential oil side that is very, very effective. And there's basically two oils, myrrh essential oil and lemongrass essential oil, that have been very effective for many people at, you know, controlling the thyroid. So, you know, definitely try that out along with the site, you know, with your physician to make sure that you know, everything is working. But many people have been very successful with that, so that's exciting too.
Good to know. Check your thyroid, folks, and pay attention to the symptoms.
Yeah. Take care.
See you soon.